big hi to everyone. We are going to talk about OIT and its revised speaking clinical information criteria. In clinical information criteria, we are going to talk about two domains in particular: information giving and information gathering. When it comes to information gathering, it is essential that you explore and elicit patients' concerns. For instance, you come across a patient who comes to you with the complaints of pain. You might ask about the duration and frequency of pain. But in UK, you will have to ask a question like this: did you have any thoughts about what might be causing this? So this is to make sure that you give more freedom, a chance to the patient to come up with his thoughts about his problem. So this is essential that you give such a kind of chance, so you gain the confidence of your patient. Most of the times, candidates those who come from India find it difficult to ask these kind of questions. It is essential that you ask these kind of questions so that you gain the confidence of the patient and you give them more chance so that they can come up with their thoughts about the problem. If I give you one more example, this not happened with a new candidate. He was senior to me in a place where I was working as a nurse. My colleague was collecting surgical history of a patient who was supposed to undergo a surgery. The patient was telling him that he had met with an accident 2 months ago and the patient was on bed rest for almost a month. So he was explaining about a terrible incident that happened in his life. And once he finished with the explanation, my colleague said, "That's okay, let's go forward with the other details." Now this is not a desirable answer or a response that we want in a clinical setting in UK. So the desired response is, "Oh, I'm really sorry to hear that," instead of saying, "Okay, let's move forward." So this is a typical example of how candidates from India respond in a clinical setting when they collect history from a patient. Now, give you the last example. So if you work as a surgical nurse or a nurse in a daycare setting, and if you find that somebody comes to you, or in fact, someone barged into your nurse's station asking about a spouse who has undergone a surgery or was in theatre for almost 3 hours, and he's clueless as to what is happening in theatre. So he barged into your nurse's station and asking for a response, and he's emotionally charged. How would you respond? Now, a typical example of how a person responds is nothing but they might say, "I'm sorry, I can understand your problem, I will help you." This is how a typical Indian nurse responds in a setting. But in fact, you're supposed to respond something like this: "I apologize for the inconvenience caused. I would be able to help you if you bear with me for a second." And I hope you understand now how you're supposed to collect information and give information when you are in a clinical setting in UK.